Welcome to the SimTech Podcast, a show where we explore the latest in healthcare simulation, from cutting-edge tech to the people who bring it to life. I'm your host Craig, and today we've got a fascinating episode lined up. Joining me is Dave from Lifecast, a company renowned for pushing the boundaries of realism in medical mannequins. We'll be diving in what makes Lifecast so unique, the technology behind their hyper-realistic patient simulators, and how this innovation is changing the way we train healthcare professionals. If you're passionate about simulation and want to hear more from the people shaping its future, then stick around. This is one conversation you won't want to miss. Hello and welcome to another episode of the SimTech Podcast. Today we're going to be diving into a Supplier showcase, and today we're going to be talking all about Lifecast. And today with me I have Dave. Welcome, Dave.
Thanks very much, Craig. Thanks for inviting me on.
Yeah, it's great to have you with us today, because I'm a little bit of a Lifecast groupie here over at the Clinical Simulation Centre.
Bless you.
Mainly because I've been a massive advocate of them, because I find them fascinating and real useful for what we do. Before we go on, Dave, do you want to give us a little bit of maybe a corporate introduction of who you are and what you do?
Yeah, sure. So I'm Dave Halliwell. I'm the founder of Lifecast. We started the company in 2016, and we actually sold in 2023 to 3B Scientific, a US/German company. So it's a story really of, starting off as a little entrepreneur and then spinning off into a slightly bigger company, and some of the learning that took place in that process. I suppose we've got that sort of stuff to share with you today. My role now is I'm Director of Innovation. So I'm looking at, what next really is the big part of what I do. So I'm still making things. As well as, helping the community, I suppose, embrace realism. Yeah. So that's where
before we
I am.
click on to what actually Lifecast is, Dave, what did you do before you came into Lifecast?
Oh, mate, honestly. So I started my career in the Army when I was 18. I was a medic in the Army, and then I left.
Me too.
Yeah, I left at the age of 21, and I moved into the NHS. Into the ambulance service, and I started on patient transport, and I worked my way up over a number of years to eventually I was head of education for the Southwest, so looking after Dorset, Somerset, Devon, Cornwall, Avon, Gloucester, Wiltshire. So we had about 3,000 paramedics that I looked after at the end of my career. It was an amazing journey, and in the middle I took 3 or 4 years out to understand resuscitation. So I was a resus officer and then head of resuscitation research for the body CPRO, and that was fascinating because I got to learn a lot of stuff, during that time. That was really when we were involved in the development of the Lucas chest compression device.
Oh yeah, so that's it's kind of the machine that goes around the chest, doesn't it, and compresses.
It's the one with the plunger, the sink plunger one that goes up and down. But that was an amazing time for me as an individual. So, what I class myself as a lowly paramedic to suddenly be involved with these amazing researchers from all over the world, and really I suppose that's where my brain started to change. I started to be interested in almost everything. And luckily I had some incredible mentors, including Prof. Chamberlain, Douglas, who, was the founder of the ambulance service here in the UK. But he took us along to meetings and exposed us to the great and the good of the resuscitation world, which was absolutely incredible, mate. Honestly, life-changing, really.
Yeah, I mean, it's I don't even know how you remember all that. I mean, that's quite a CV that you've got there, really.
Yeah.
What was the spark then that kind of thought, what, I want to do mannequins, I want to do these life.
I never wanted to do mannequins. It was a byproduct of just working with what I perceived to be crap mannequins. So I had because I had 3,000 staff, I had about 27 trainers, and every year they would break the mannequins, and I would sit and I would watch the training, and the same comment would come up time after time when it's not like this in the real world, is it? And I just thought, you know what, I'm gonna do something about this. I'm gonna make it more like the real world if I can, and that was really the catalyst, I suppose. In 2012, I went to work in the Middle East, and I still remember the session actually, but we were teaching biological and chemical warfare and decontamination stuff. And we were teaching people just how to decontaminate patients with a chemical agent on them. But you needed to be able to spread their toes and their fingers and pull their butt cheeks apart and lift their genitals up and generally clean all those areas. And, in my military training, maybe 20 years earlier, I'd been able to do that. And suddenly there I am faced with this lump of plastic that's fingers didn't move apart and its toes didn't move. And I couldn't pull its butt cheeks apart. Then it was like, what am I doing? This is just stupid. And I think, it took me 5 years from that point on to actually start on the mannequin journey. But that was really probably the day when I thought I cannot work with this plastic stuff anymore. It was a real turning point for me.
And you're quite right. I mean, as a centre here now, we're trying as much as possible to step away from what we're saying high fidelity mannequins, because maybe we're all part of we've all been falsely advertised to these massive, expensive gimmicky mannequins, and we've all fallen.
We've all been brainwashed. We've all been brainwashed, and I was the same man. I was that man, 15 years ago. I had a budget of, £500,000 that I would spend every year with the same people, same supplier, because I was lazy. I didn't know any better. Didn't go out and look for others. I just sat behind my desk and the rep would come in and say, ready to place your order again this year? And I'd just sign the check. And, it was, now I look back on it, it was completely bonkers. But if you can imagine, there are 13 ambulance services and probably most of those guys are doing the same thing. And then there's God knows how many hospitals with people doing the same thing. Then actually, catering for the lazy guy was a very clever marketing strategy. Literally, they just came around once a year, walked away with £500,000. Thank you very much. And the world seems to be slowly embracing the fact that the stuff may not be as fit for purpose as we needed. I was lucky if I got 12 months out of a mannequin, because of the sheer numbers of staff that we are putting through them.
Yeah, so. It's almost like you're not taken seriously if you don't have a high fidelity mannequin.
No. Yeah.
I mean, there is a place for them. Don't get me wrong. I mean, we definitely use them for things like difficult airways, where you need to be able to control that kind of stuff. But we're like I say, we're stepping away from them. If we can use a real person,
I think that's always the key. I think that's always the key. I love wearables. I love wearable tech. I'm still a bit of a tech geek. I'm still looking for new ways to use tech to achieve what I need to achieve. And I know we'll come on to that later in the conversation, but I do find a lot of the new tech really quite exciting. It's just understanding how you can achieve your learning outcomes using it, but there's nothing as real as a person. And, that's a good starting point, I think.
All right. So we might have jumped the gun a little bit. We've made a few assumptions. Let's just say no one's heard of Lifecast and they've been living under maybe a little bit of a rock. How would you describe what a Lifecast is? Or Lifecast is?
So, I mean, Lifecast, we've got a tagline and we say we copy real people and turn them into mannequins. And I think that's the starting point for what we do. So we use a mixture of 3D scanning and life casting, which is a process involving laying somebody down, covering them in alginate, covering them in plaster Paris, making molds using a very hands-on technique, compared with 3D scanning, which takes us about 15 minutes to copy somebody. But yeah, we copy real people and turn them into mannequins, and that's the background, I suppose, and the ethos behind Lifecast. The second part of what we do is we speak up for people who don't have a voice. And again, I suppose it's a personal thing. It's, I say as the founder, I got to set the direction. So, there were changes made to prematurity. They dropped the age of, preemie babies down to 22 weeks. weeks, and nobody was making 22-week mannequins. So let's make some so we can teach people what a 22-week mannequin looks like. There was nobody catering for children who have Down syndrome. So we made Gwen, a little girl with Down syndrome, so that we could talk about that stuff. And I suppose Gwen's a good example, really. You know, that in my clinical career, I didn't get taught how young children with Down syndrome are different. I knew the basics, but I didn't know that they had a C1, C2 instability in the necks. And so when I first met Gwen's mum, a lady called Cora, she said, Dave, you know, every day I send Gwen out to school, I'm worried that the ambulance crew will come and they'll do a jaw thrust. They'll do a head tilt chin lift and not a jaw thrust on her. And she's like, if they do that, they could paralyze my child. And that for me was an absolute wake-up moment. Was like, I've gone, you know, through a fairly extensive medical career. I mean, at that point, probably 35 years. Nobody had ever mentioned that before. And
a little bit of me feels like, God, I didn't even know that. And I could have easily been in one of those positions as well. It's so
yeah,
scary, isn't it, when you think of that?
it's bonkers. And that's really, I suppose that's the point of speaking up for these communities. You know, if I can help another Cora not have to worry, and if I can teach paramedics that then they walk in and see a kid with Downs, that actually, yeah, I'm going to jaw thrust this one. Very, very simple thing. You can teach it all you want using slides and stuff, but it's not the same as getting hands-on. And yeah, that was the real thing about making the mannequins. And we do old people because they weren't very well represented. Most recently, we've done a young girl who's got cerebral palsy and scoliosis. We did a tiny babies. And we've also started doing recognition of death, so mannequins for post-mortem staining and that sort of thing. Because, again, you know, you read the guidance, and I'm sad enough that I'll sit there and look at a guidance document when it comes out, and it will say every paramedic should be able to recognize liver mortis, or, you know, you should be able to see these signs of death. And I'm just like, whoa, hang on a minute. You know, nobody taught me what they look like. I can see it on a photo, but what does that actually mean? So we've started embedding that into some of our baby mannequins so people can run, a full resus. But then if they turn the body over, they would actually see that the baby's been dead for a couple of hours. And so you can have those bigger discussions, about this stuff. And I think for the sim community, I suppose I see my role as, you know, I very much want the first time you encounter a dead baby that it's a lump of silicon, but you'll still have that same emotional reaction if it's a Lifecast type baby, because it'll be warm, it'll look right, it'll move in the right way, and you can have that experience in a safe environment so that when you meet that, you know, that first dead baby in the real world, you can say, it's okay, I've done this stuff before, you know, and that's really how I see my role, and that's how I see the role of Lifecast, you know, just there as an education company to try and share as much as we can.
Yeah, I mean, it's weird that you brought up the Down syndrome mannequin, because we was only the other week having this kind of discussion where we was thinking about doing a simulation, but we was considering maybe the ethical dilemma of putting in an actor to
Mm-hmm.
pretend that they
Yeah.
had Down syndrome. And obviously, we after a little bit of a discussion, we kind of ruled against it because we just didn't think one, it was
No.
right, and two, you know, it just didn't feel like a good scenario with someone pretending to do that, and that's exactly
Yeah.
where Lifecast kind of comes in, doesn't it?
Yeah.
It
And
fixes the issue.
I feel the same about a lot of the things. You know, we get people to pretend to be older than they are, or they put masks on, or they change race, and
Yeah,
it's like, are we really doing people a favour by doing that? You know, Gwen herself is happy to come and act for you. You
yeah,
know, the real Gwen. She's 11, 12. You know, she'd be happy to come in, and her mum would be happy to come in. And you know, they live over in Liverpool. But you know, a session with Gwen and her mum is invaluable because you learn so much. You know, and that was what blew my mind. You know, the first day that I sat with just totally and utterly blew my mind because I thought I knew a lot of this stuff and I didn't have
yeah.
a clue.
And that's exactly what you're doing there, right? You're telling people's stories, aren't you? And
Yeah. Oh yeah. I've become a storyteller. Yeah.
and I suppose how do they feel about being part of like a project like this?
They love it. And I think that's the main thing. I think Gwen and her family absolutely, I mean, we're just so privileged, really, and it's not just Gwen. We've copied other children. We've got a little boy called Christopher as well, who is in the system, and at some point we'll push go with his creation. But it's one of those where the families are involved. The families want to talk, to as many healthcare professionals as they can, and this is one of the ways of getting those conversations out there. And and from our point of view, we're happy to help tell the stories.
What's it like when they first see their mannequin for the first time? I can only imagine, the
Yeah,
reactions that they're going to get.
I wasn't there, so one of our guys, Stuart Hilditch, was in the meeting, and they did it live on ITV, where Gwen met Gwen, and she just said, "Oh, it's me," and it was like, "Oh my gosh," tears pouring down your face watching this amazing moment. But yeah, Gwen embraced it, and we took. I mean, it's an interesting story. But we took Gwen out to IMSH. And again, with hindsight, it was probably a really silly thing to try and do. But, I hadn't realized that 2,000, 3,000 people would be so overwhelming. So we got there on day one and we were like, do you know what? This is not going to be the place for Gwen to come. I know everyone wants to see her, but actually it's not going to be the right environment. So Cora and Gwen, they went off to Disneyland instead, and they had a 2-week trip to Disneyland. But it was amazing. We got to spend time with them in Disney and talk about the conference, and and spend a bit more time hanging out, which was actually a really great thing. And I think again, it's that doing the right thing. That's really, I suppose, that's become a driving ethos. To try and just do the right thing. Not saying we get it right every time.
No, exactly. So what was the first one you made? What was the first mannequin?
First mannequin was a little baby called Christopher. To just delve back, I suppose I should go back in the story. So I'd been working on trying to get realistic with mannequins, and I reached out to a guy on the internet called John Schoonrad, who had been working on Gladiator, Saving Private Ryan. His CV is amazing. His IDMB page is phenomenal. And I was just like, look, we've made this Frankenstein's monster. Can we bring it up and you can have a look? So I sent him some photos. He sent me back a 2-worded email and it said it's shit. And I was just like, oh wow, this is phenomenal, this bloke. And then I never heard from John for about a month while he was ticking away thinking about it. And then he said, come and see me. And I saw what he was able to produce for the movies. And I was just like, this is where we need to be. This is the level of realism I want to get to. So the first baby we ever made was actually a sucking baby. It moved its mouth just subtly to mimic sort of suckling. And we called it the breastfeeding baby because that was the sort of movement that it had. And it was that bright pink colour, the healthy newborn, like guttural thing where you look at it and you think that's a newborn baby. Amazing colouring, absolutely phenomenal paint job. And we took that to IMSH in, I think it was 2017, again back in Orlando. And the feedback from the audience was just unbelievable. People were just coming from miles around to see this thing. And so, yeah, Baby Christopher was the first. The second was an adult. And again, it happened around the same time. We had a random reach out from the SMAC group, Social Media and Critical Care conferences that used to run. And they wanted to do something a bit different. So they wanted us to copy a lady who lived in Australia, an actress, and turn her into a mannequin. And she was going to run a session on the stage, then collapse, and we would swap her for the mannequin subtly. And then they would perform a full resus on her in front of about 2,500 people live on stage. And the only thing was that swap over piece. So the second mannequin was one called Renee, and that's what it was. And that created me a lot of ethical dilemmas later on. I mean, copying Renee wasn't a problem. Producing the mannequin wasn't a problem. But it was, Renee works as a pretty famous actress on like Home and Away and that sort of stuff down in Oz. And And so having a mannequin of her that could be potentially used as a sex doll or God knows what was a real issue. And Renee was very, very protective of her image, quite rightly. And so, we had to, well, in the end, we gave her the mannequin. We didn't want to be responsible for any inappropriate stuff ending up on the internet. And so it was like, do you know what? Actually, we're just going to give you the mannequin because we don't feel it's something that we should be holding on to. But that sort of ethical dilemma around people's actual image being a mannequin is a really fascinating area. And again, something that probably only us in Lifecast really have to worry about. But we do, because they're real people.
So how does this happen then? Because you mentioned that you're casting them as you. So
Mm-hmm.
I'm envisioning you just pouring this liquid latex kind of stuff over their bodies and waiting for it to set.
Yeah, it's more or less like that. We shove it in every orifice.
Yeah.
So you lie nakedish on a slab, and then a team of about up to 10 people will shove this greeny bluey stuff all over your body, and that will set hard, and then we'll cover that in plaster of Paris, and then we'll cover that with wooden slats, and you're basically sort of lying on a board naked for around about 20 minutes until it sets. It's very, very invasive, and a little bit sort of messy as a consequence. So actually 3D scanning somebody is so much cleaner, so much easier. We can, put one of our techs on a plane and they can arrive somewhere and do a 3D scan of somebody, and it's so much easier. And certainly for the movies, obviously, again, the Tom Hankses and the Arnold Schwarzeneggers, they don't really want to be life cast. I mean, they have been, but it's not something they want to go through very often. Whereas the 3D scan, yeah, fine, take my image and, keep it safe is a much easier way to do things. So, yeah, we got some clever people around us, obviously, who do that stuff.
I mean, it must be challenging, getting babies into that kind of area as well.
Babies are a nightmare. So again, luckily the 3D scanning world came along, but we use sculpting quite a lot as well, to refine imagery. So, and that's either digital sculpting or physical sculpting of clay. So sometimes we'll manipulate the image, and sometimes we'll actually, produce a clay version and then work on that. And again, we've got incredible sculptors. We're lucky we're based in a movie studio, so we're surrounded by pretty clever people down at Elstree.
Yeah. So I encountered one of your little babies the other day. So with the Avkin model, the
Oh yeah,
wearable
yeah,
birth simulator. So at the
good.
moment, our centre is going through uh, sim mum replacement kind of
Yeah,
options. So
yeah,
we're demoing the options. So we Adam Copperwaite from Avkin. If you're
yeah,
listening, thank you very much. He's lent us a demo model, so we get
very
him to
good.
play with essentially
Yeah.
this wearable birthing simulator, which pushes out a life cast baby.
And I love the fact that it is it is wearable, that you can go through all of the, stop whinging, stop complaining stuff,
Yeah,
um, and actually have that whole birthing process in front of you. And it's fascinating what comes out of people's mouths, and that's why I laugh about the stop whinging, stop complaining, because that's what I heard. Somebody was going through a birthing sim, and I listened, and it was like, oh my gosh, we've got a long way to go. That's the standard of care that you think is going to be acceptable. So it's amazing, but that's what simulation's for, isn't it? I mean, we're there to have those little moments where we realise somebody needs a little bit of work on a
yeah,
specific
exactly. If
area.
we're trying to make simulation as immersive and high fidelity as possible, you
Yeah.
need to go these little extra miles, don't you? And these mannequins are not always the
No.
best way to do it.
And I think the fact that you can control the blood coming out and the amniotic fluid coming out, and then a baby comes out that needs resuscitation, again, always capable of being resuscitated. Actually, that takes you through the whole cycle, which again, I think for me was why I fell in love with the Avkin product, because actually there's a hell of a lot of good you can do with that.
I mean, one of the things that I was slightly concerned, and I haven't fully tested it yet, is that Livecast. It looks quite fragile, and to be
Hmm.
pushing this out of essentially a very small hole, I was
Yeah.
worried. I was worried, maybe an arm gets bent back or a leg gets caught or something, and it's going to
Yeah.
snap off.
We
But
we
that
work
really
with them.
shows you how durable they are.
Yeah, they are durable. I mean, you can hang it by its leg or its arm. You know, with the Avkin, we're putting reinforcement in place. So again, just through the back of the knee and in the elbow areas, just so that, you know, those things don't happen. But, you know, I love the fact that you can create a footling or an armling, you know, and again, to rock up as a paramedic to suddenly see a hand waving at you is like, oh my gosh, what am I going to do now? And, you know, any tool that can create you that, oh my gosh moment, I think is what we should be doing. Yeah.
Yeah, and you're right, because sometimes we're finding it double edged. When you've got these little life cast babies, and maybe the midwife or the nurse walks in a little bit unprepared about of what they're going
Yeah.
to see, and they see this, very
Yeah.
ill, real life baby
Yeah.
on the
Yeah.
bed or in the cot, and you get this really quite emotional response from them, don't you?
Yeah. I think that, you know, your pre-briefing has to be good.
Yeah,
And I think, you know, if you can do pre-briefing and orientation to the mannequin, I would say with every life cast mannequin, do that before you throw somebody in it,
yeah.
because there is that risk of PTSD, you know, and I still get it. I still see things and I think, wow, that's so real. And then I'll go back to that particular baby and, you know, maybe 30 years ago in my head. So yeah, it's a big part of it.
I mean, we still have to lock our Vivian up, mainly because
Right.
I suppose the cleaners are kind of used to her by now, but
Yeah. Yeah.
window cleaners and things like that, they're just
Yeah.
not prepared to see Vivian. I've got to
No.
say, Vivian is one of my favourites, and I think she might be a national treasure at this point.
I think so. And again, Vivian's backstory as a human being is incredible. You know, she's an empress in Star Wars. She's in the movie Fury with Brad Pitt.
Mm.
You know, she's the mum in the Human Centipede movie. I mean,
I can't
you know, how
believe
much
you
dark.
brought that one up. I was gonna go past the human centipede.
Okay, but you know that's Vivian, and I think, you know, she's worked with the greats. She's also worked with the greats in other parts of her life. She worked for Vivian Westwood as a model, and you know, and again, you know, you look at that career and you think, wow, wow. You know, we were just lucky enough to you know be able to copy her. You know, she was working at Elstree, and she said, yeah, I'll get involved. I'll go on your journey with you.
Yeah, I mean, she is. Yeah, she's fantastic, and so we have a baby, we have a child, and we have a Vivian,
Brilliant.
and the responses from Vivian are so. I love just the first time people see her,
Yeah,
because
yeah.
she's just so real. You know.
I remember the first time we took her to any conference, it was the Resource Council,
Mm.
and I can't remember where it was. I want to say Manchester, but it might have been Birmingham. But the first time we took her out, everyone was just like, "Oh my gosh, what is that?" And it's like, it's got to be a real
Everyone wants to,
person.
everyone wants a little
Yeah,
touch, don't they, just to
they
see
want to
what they.
touch. Yeah, yeah. But I think Vivian's good for the emotions. She's like everybody's grandma, you know, and you see people holding her hand, stroking her hair, all that emotional engagement stuff that, you know, that we really wanted that you can't get with the plastic, you
Yeah.
know, and I think that's the real point for me.
Yeah. So you mentioned that you're responsible for the innovation and the what next. So what's in what's
Mm.
what's in the pipeline?
Oh. Um, Finishing off the girl with cerebral palsy, I suppose, is the big one for me. That involves a bit more articulation in joints.
Mm.
3B, because we sold to 3B obviously a couple of years ago. 3B now own lots and lots of companies, and if you've been following the industry, then you'll know that you know they're now the second biggest player in the simulation world. Turnover above 100 million a year, you know, and as a result of that, you know, they bought an ultrasound company, they bought iSimulate, they've bought a veterinary company, they've bought a ventilation company. We've got immersive interactive, the classrooms, and we're all under one portfolio now. So the great thing for me is if I want to add ultrasound onto all the mannequins, we've got an ultrasound company. If I want to put ventilation stuff inside, we've got a ventilation company. So the biggest part of the day to day now for me is the integration. How do we bring all these things together? We've also got a surgical company, Strategic Operations, based out in San Diego. And again, fascinating to look at their stuff, but also look at how that could be, you know, integrated inside everything that we do. So again, the ability to have, suturable organs and other stuff along those lines sitting inside the Lifecast makes things really exciting. With iSimulate, obviously iSimulate started the Atlas Mannequin program. They're plastic that links directly with iSimulate. And again, the ability to put that tech inside Lifecast has been a direction of travel that I've been on for the last year or so. Just making space inside the mannequins for that tech to go in, because some of the original ones are quite solid inside the chest, but now we've got cavities and stuff in there to be able to house the tech. So, it's a really interesting, and I suppose for me personally, the most exciting part is bringing all these other bits together.
Yeah. I mean, maybe a silly question, but a very obvious question for me is, why is there no kind of amalgamation between what we'll call a high fidelity mannequin and a life cast mannequin? So why don't we make a life cast mannequin that maybe has all the components that a traditional sim man would have, with the difficult airway and the sounds and all those kind of things?
I think it's just a case of watch this space. If I'm honest, I think it's coming. I think it's just a matter of time more than anything else now.
One mannequin to rule them all.
Sorry?
One mannequin to rule them all.
Yeah, well, yeah, as I say, I'm fascinated by the companies that they've bought, and at the moment we're still in that learning phase of how the hell do you do that, and why can't I do this, and and then it's like, okay, well I need a cavern inside my body to house the tech. Let's do that, and then let's worry about the next part after that. So that's really the phase I'm in at the moment.
And do you think, has AI or VR ever come across your doors? Have you got anything in the pipeline to do with those?
I love mixed reality.
Yeah.
So I love mixed reality. I love AI, and I suppose SimConverse would be my logical one of absolutely blowing me away the first time I had a conversation with SimConverse. And then it graded me on how well I took a history, and it told me how good my language was and my empathy and God knows what else. And I was like,
I mean, I first came across it up at Aspie, so the guys from Australia, and I've had them on the podcast as well, so you can catch that episode. But what blew me away was how responsive it is and how quick it can deal with your questions. There was no thinking time for it; it was just almost like an instant response.
No, and I did the usual me thing and actually went out my way to give it bad treatment.
Yeah.
So I wanted to see what it would do. So they gave me the scenario of the angry man whose mum had been, given, I think she had a urine infection, but what was causing it. So I said, well, I think you've caused it. I think you've overdosed your mother. And the AI actually went in that direction and got more and more angry. Yeah. And I was like, okay, this is actually really cool then, because I was expecting that it would be a bit stuck at that point, but it wasn't. And, and it gave me the sort of reaction that I would have expected.
I mean, it's scary to think that if you put that kind of technology inside a live cast mannequin, I mean, it's scary to think where we'll be in, maybe 5-10 years time.
People are doing it, and it won't be long, and I think that's the beauty of a lot of this stuff is, that the clever part of that was the grading you on your, it wasn't so much the conversation, but it was the grading you on that conversation, and the back end feedback that you get was just like, wow. And I suppose, I've seen other models, trying to remember the name of the team, and I can't, but there's a team out there that developed a AI camera, and it watches you wash your hands, and then it grades you on how well you washed your hands. And it seems the most simple thing in the world, but every member of NHS staff has to sit there every year and be graded on washing their hands.
Yeah, they use this kind of ultraviolet stuff, don't they? It's like little dust, and then they have this torch, don't they, to see what parts of the germs you missed.
And this one's different. This is just a camera that sits above the sink, and says, "Well done, you've washed your hands and you've cleaned every part of your hands, and here's your certificate for another 12 months." Wow. And that process takes 2 minutes, 3 minutes to wash your hands and get your certificate. Whereas if you go through the other thing, we sit there for an hour of our time, every year, every NHS clinician sitting there being taught how to hand wash, whether you're a surgeon, whether you're a paramedic, a sim tech, every single one of us wastes an hour just washing our hands. And if that can be dealt with through an AI camera, then yeah, I'm all for it. If there's a way of doing that, then that's what we should be doing.
Yeah, you'll have to get that name to me because it sounds fascinating. I'd love to get them on.
Yeah,
Maybe
they're
speak.
based up your way.
Yeah.
I'll wish you the name. Yeah.
Fantastic. All right. Like I say, we're coming to the end of our time, Dave. Really, before we start, boring people because we're just too enthusiastic. If people want to get hold of you, what's the best way of getting in touch with you?
Just type in Lifecast body simulation into the net, and you'll pick up either the 3B site or the Lifecast website. The other option for me is always LinkedIn. So you'll find me under David Halliwell on LinkedIn, and again, that's a good place for having the geeky conversations.
All right then, Dave. Well, I think I should give this opportunity. Any final comments that you'd like to say to anybody listening before we sign off?
No, I suppose for me, I mean, it's been real fun to have been on this journey for about 30 years. I think the simulation world is changing, and I think the fact that we now have SimTechs is amazing. I think they're the backbone of what everybody's trying to achieve. I think maybe when I look at the bigger, wider education world, I worry that we've gone a little bit too far down the woke side of things. Sometimes we're frightened to upset students or, expose them to certain things like the dead baby as an example, but I also think there's a place for sim in that protective field of, reducing PTSD and giving people opportunities to have experiences that they wouldn't otherwise have had. I suppose for me personally, that's the important part, is that crossover back to mental health, physical health. And I suppose, that's where I see the simulation world playing its biggest part.
All right, Dave. Well, thank you very much for joining us today. It's been fascinating talking to you and learning about your journey.
You're welcome. Thank you.
Cheers, buddy. And that wraps up this episode of the SimTech podcast. A huge thank you to Dave from Lifecast for joining me and sharing his insights into the incredible lifelike patient simulators. It's always exciting to see how innovation is shaping the future of healthcare training. If you enjoyed this conversation, don't forget to subscribe, leave a review, and share it with your fellow SimTechs. You can always reach out if there's a topic or guest you'd love to hear from on the show. Until next time, keep pushing the boundaries of simulation, and I'll see you on the next episode of the SimTech Podcast. Welcome to the SimTech Podcast, a show where we explore the latest in healthcare simulation, from cutting-edge tech to the people who bring it to life. I'm your host, Craig, and today we've got a fascinating episode lined up. Joining me is Dave from Lifecast, a company renowned for pushing the boundaries of realism in medical mannequins. We'll be diving in what makes Lifecast so unique, the technology behind their hyper-realistic patient simulators, and how this innovation is changing the way we train healthcare professionals. If you're passionate about simulation and want to hear more from the people shaping its future, then stick around. This is one conversation you won't want to miss.